Hey everyone! So I'm going to be doing frequently asked questions about rhinoplasty, and regarding the video that I put up with the before and after pictures, I just wanted to say thank you so much to those who wrote really sweet comments and really positive comments. I wasn't really expecting all the positivity. I know many of you women in the TTC community are so amazing, but I kind of expected a little bit of negativity, but surprisingly everyone was so sweet. So that really meant a lot, and I just wanted to say thank you so much for the really nice comments. So I'm just going to go through the video and answer the questions. Hopefully I don't miss any. The questions appear really small right here, so hopefully I don't miss any. So Cause J Pouch IVF asks, how long did you need off? What was recovery like? So I only needed 2 weeks off, and recovery, well, like, I watched a lot of videos prior to getting the surgery done about recovery, and pretty much everyone was saying how it was easier than they expected, and there was no pain, and it was just, they made it seem like it was a breeze. So my mistake was watching that and thinking that it was going to be nothing, because after the surgery, it was a little painful, but I was okay. But the following week was awful. They failed to tell me that the pain in your throat is horrible. You can't eat anything. It's almost as if you had throat surgery instead of no surgery. My throat hurt so bad just to even breathe, and I had no choice but to breathe from my mouth. So it hurt so bad, and then after a few days I took a flashlight to the back of my throat, and it wasn't my throat, it was actually my uvula, that thing that just hangs down, and that thing was white with dots everywhere. And I googled that, and it said sometimes when the breathing tube goes in, it scratches it. And since I was healing from my nose, that thing took forever to heal. So that was the worst part of the whole thing. I couldn't eat it. Like, I would cry to eat. That's how painful it was. I had to eat soup, and it had to be like liquid soup, because anything that would touch it just hurt. It couldn't. My food couldn't be salty, no tomatoes, like stuff like that. It just hurt really bad. Even like the painkillers wouldn't help. What else? So I had a comment from Heart Rose 33. She says, it looks great in the before pictures. It looks swollen and hard to breathe from. So I didn't do this surgery because I couldn't breathe from my nose. I did this surgery because like my profile in the front, does that make sense? Profile in the front. But anyways, the view from the front I was fine with. But it was any picture that I would, like, especially that other people take of me, that I would be leaning to this side or this side. It would because my nose, I think it was broken when I was younger, because my sister threw something at my face and I had black eyes following that. So I'm pretty sure that's what happened. And as I got older, the side of my nose got bigger and bigger. Like, this side was okay, it was still a bump there, but this side was bigger. So every time I would see pictures, this side would always have a shadow here, and it would just make my nose look even funnier. So I had a huge thing with people taking pictures of me, and I had to always watch out certain angles, because the shadow would just give me like this really weird thing. It didn't even look like me, and that was the big thing, was I'd look at pictures and that's not what I look like when I look in the mirror. So yeah. and like in my family, certain people do have the nose that I had, and as they get older I can see how much their nose is drooping, and it's not very feminine. And I don't know, I guess the past 3 years have just been really hard on me. First the car accident, depression, the baby loss, more depression, just stuff like that. I just wanted to do something for myself to make me feel better. I've been saying since I was in high school I wanted it done, and I keep saying next year, next year, next year. And so I just ran into the perfect time to just do it. What else? Karina Delgado asked about the price. She says, please talk about price. If it's okay with you. I've wanted this done forever. I still want one, but have no clue how much it will cost. So I'm pretty sure every surgeon is different. And there's different costs for like where you want it done, private ones, and your consultation. So what I paid for consultation was $300 and something, but then that gets added to your surgery cost. Like it gets taken away from your surgery cost. And it was $300 and something because I had what's it called? It's where they take the picture, the before picture, and show you what it could look like, which I posted in that video before this one. So that was $300 something. Then the surgery was, what was it? $6,800. I also had to have a down payment of $500 a few months before the surgery. A week before the surgery I paid $6,000. $6,000 plus $300 that I had paid already, plus the $500, it's $6,800. So in total for everything was $6,800. So Sarah and Wade 86, did they show you a picture of what it would look like with it done before the surgery? If so, does it look the same? So the thing with rhinoplasty is it takes a whole year for you to see the final results because it swells so much. So like the tip to me is still very swollen. Like this is going down a lot since I've had it done. Since I took the cast off, this it was smaller, and then like, how do I explain this? When I first took the cast off, it was really small, and then like a week after, it slowly started getting more and more swollen, and now it's going lower again. So yeah, if that makes sense. But it's still swollen. Like it's gonna take a long time. Like this is still, and it's still a little bit numb. This is where most of the swelling is. But yeah, to me it does look like the picture. The only thing that's different is this. But when I first took off the cast, the picture looked exactly like what my nose looked like. Oxy777 asks, how much does it cost? Does it hurt afterwards? So like I said, it costs $6,800. And does it hurt afterwards? Like I said, it was mostly my throat. My nose hurt a little bit, but it was mostly numb. So Athena Alexiadou, sorry if I butchered your name. She says, Jessica, I'm considering to do the same. When did you have it and how long did you have to stay with the plasters and in the house? So I had the procedure done May 21st, and the cast was on for a week, and my doctor was really busy, so he could only see me a week and a half later. But after a week, I was becoming really impatient. I was becoming really impatient, so in my bathtub I took it off myself. It was very easy. You just kind of just take the tape away and you just peel it off. Was it painful? Like I said, a little bit, mostly my throat. Was there something that you couldn't do? Well, I had to stay in my house for a week. I couldn't eat. I had to sleep with a few pillows and sitting a little bit upright, and I couldn't sleep on my side. Well, I could, but it kind of not ruins, but it interferes with the healing because more blood will be on one side or something like that. Is there something that I need to be careful with now? Basically just hitting it, which I've hit it on my nephew's head. Sometimes I hit it with like a towel when I'm cleaning myself, like just accidentally. It's like very stiff, so I feel it right away, but nothing has happened. They say after the operation you are bruised and cannot see the results right away. They are visible in 6 months. Yes, but they say after years when you fully get to see the results. After 6 months, I think it does go down a lot, but you don't get the full 100% look. The whole 100% results that you're looking for. And cost, I already said, was $6,800. The Segura family asked if it was painful. I answered that. How long did you have to wait to put makeup on? So I didn't put makeup on until I went to go see the doctor, which was a week and a half later. And it was very, very weird. I did have to be careful putting makeup on because it was so stiff and painful to the touch. So like when you're putting makeup on, you're kind of like wanting it to blend, right? And it's hard to do that because it's very painful here, and here it was numb. So it was just really weird putting on makeup. I didn't put makeup on like I usually do just because it was very strange. Pico Bear asks if I would consider another surgery to change something else, and what do I think about plastic surgeries in general. This is a not tricky, but this is kind of a hard question to answer just because this was something that bothered me for a long time, and I am all for if something bothers you, go do it. If it's gonna make you feel better, then do it. But I'm also for still making sure it looks like you. Like this is just personal, my personal thought on it is if when people get something done and it doesn't even look like them, like a big one is Heidi Montag, how she doesn't look at all what she used to, and sure she looks great, but at the same time she's so young getting those surgeries done that what is she gonna look like in like 20 years? But if it's something that bothers you, I'm all for it. Would I get anything else done? That's the thing I don't know. Like right now, nothing else bothers me. This is the only thing that really, really bothered me. So I can't say no because I don't know. I just, of course, when you see those ladies having all that Botox done and like, what's her name? On Fashion Police, whatever her name is. The older lady, I think she looks horrible, sorry. She looks horrible. And then her daughter having all those surgeries looks very weird as well. Their faces just look weird. Like, I'm not for that. Like, no. I believe in just getting things done that is gonna make you feel better, but don't change your whole face. But that's just me. I don't really care for what people want to do. If that's what makes them happy, go ahead. But my opinion is they do look funny. I think that's all the questions. Yeah, I think that's all the questions. If I did miss a question, I'm so sorry. I think I covered everything. Pain, the cost. Oh, one question that wasn't asked, but I don't think I mentioned it. No, because I haven't even made a video on this. Duh. If it was opened or closed, and this was closed rhinoplasty, which means they went in the nose and did everything. Open is when they cut this and then they take the skin over and do that. But he said my surgery was pretty straightforward. One thing that no one's mentioned and you'll probably notice is this side has a bump and this side goes in. I don't know if you can notice. Yeah, for sure you have to notice. It goes a little more in. And I had that prior to surgery. So it just looks funny now because it's so swollen and it looks even more. Plus I had my, what's it called? My nose pierced right here. So that's why there's that line there as well. So I think I'm going to get my nose re-pierced just so you don't see that line. And it'll kind of look more normal. But I'm very, very happy with it. There's nothing else that I want to do to my face. Nothing right now anyway. This was just something that I really, really wanted to do. Everything just fell into place. Everything was just, I don't know, like things were not going well with the whole baby situation. My doctor went away for 2 months, so me and Justin were like, well, let's just stop trying. And I'm like, a big thing as well was, you know how sometimes you kind of plan for something, it doesn't happen, so then you're planning for something else and that first thing kind of falls into place. Does that make sense? Like, how do you say this? How do I explain this? Like, you buy a snowblower and that winter it doesn't snow. I think you guys get my point. That I wanted to get my nose done, but I wanted a baby. And even like I started booking it in November when my doctor went away. And I thought to myself, well, if I don't get pregnant, then I'm getting my nose done. But if I do get pregnant while I'm trying to go for this rhinoplasty, then it's a sign that, okay, I don't need my nose done and I'm gonna have my baby. So it was like, I would rather have my baby, but if I'm not going to, I'm on my way to getting rhinoplasty, which is something I wanted for a long time. So it's kind of like a stress reliever at the same time. Like that whole time that we were not trying, I had in my head, okay, it's okay because I'm gonna get my nose done. It's okay, I'm gonna get my nose done. And funny thing is, a month before I went to get it done, I fell pregnant and I didn't know. Like you guys know about the ectopic pregnancy. I had no idea, and I did blood work at the doctor's. They didn't know that I was pregnant, or they didn't tell me. I don't know what happened there. I guess with an ectopic your levels are lower, I don't know. So, who knows? I'm just happy that I got it done, and I'm a lot more confident and happy. Oh, I also have this here. This is the doctor that I went to is in Toronto. His name is Richard Rival. That's the pamphlet that they gave me. And they have 3 locations. They have Newmarket, they have 2 places in Toronto. So that's what the doctor looks like there. He's a younger guy. And that's some of his work. So my nose is kind of like that one now. Yeah.